So the next session is on monitoring and surveillance. There are a lot of legal questions around privacy when we start monitoring people's activities. And when the person we're monitoring may not have the mental capacity to give consent to the monitoring, we run into grey areas. And also when the people providing the caregiving services may not be comfortable being monitored themselves around the care they're giving to the older adult, it gets even more complicated. And then you have the liability where somebody with dementia may wander off. Last year a lady died in North Vancouver in the forest. What is the liability? What's reasonably to be expected of a caregiver? So Algina is going to talk about the situation for paid caregivers in residential care homes, for example. And Wendy's going to talk about the situation for family caregivers, where the older adult is still living in their home. And then Micheal Vonn is with BC Civil Liberties and is going to talk about the legal questions around privacy. And as they'll all tell you, this is a fast evolving and still uncertain area of activity. So Algina. And as we were told yesterday, if you want to read more about these people, their resumes are in the handout package you got. We weren't to spend time talking about it here. And if we can hold all the questions till the end, as there are 3 panel members, that might go better, and there will be lots of time for questions at the end. Thank you.
Good morning, everyone. Surveillance and monitoring residential care, very, very interesting area, especially in residential care. I just wanted to introduce myself. I am Algina. I am a lawyer by profession, but my wife is a nurse, and she got me into the long-term care business. And initially, I was fairly naive in terms of how operations go, but I realized this is a very, very sort of complex area, and there are a lot of issues around that. And I'm going to take you through some of the issues that we encountered at some of our homes, how we deal with them, and also some of the parameters when it comes to ethics law around surveillance and monitoring. So the presentation will examine the use of surveillance from these perspectives. What are the ethical implications? What are the legal regulatory implications? When and where should this technology be utilized in residential care facilities and homes? The reasons for surveillance in residential care are fairly apparent. You want to optimize the use of available staff on the floor. You do want to have some form of digital monitoring of spaces beyond the visual range, such as your building exits, entrances. You do want to ensure that standards of care are maintained to meet company policies, licensing core requirements, and you want to provide an accurate record of interactions between your vulnerable population residing within your facility and staff and with each other as well too. But there are, of course, many issues that have to be considered. So what are the ethics governing surveillance and monitoring? What is the governing legislation in BC, including the BC Residents' Bill of Rights for Seniors and Residential Care? And just this year, I did a webinar with the Canadian Bar Association with 100 lawyers, and they had even more questions for me as well too. So it just shows how vast the scope is of the questions in this area. The Criminal Code of Canada has some prohibitions that we will consider, and some case law as well too, especially the case that Martha Jane Lewis just mentioned in North Vancouver involving a resident. U.S. legislation, what are the trends in the United States, and some reasons for and against electronic surveillance and monitoring. So the ethical issues, there are a large number of stakeholders in a residential care facility. It's a home. You have residents, you have your professional staff who have to meet requires the Health Professions Act. You have housekeeping, you have caregiving, you have dietary staff, you have the administration, you have families, friends visiting, you have visitors and volunteers, you have the unions and collective agreements to manage as well too. There are regulatory agencies, licensing, health authorities, as well as your provincial funding authorities as well too. So what is ethical for residents? And all images used in my presentation are real Park Place residents, and in keeping with this presentation, they have provided their consent, and they all are happy to be acting, and some of them say, please tell your audience hi from us as well too. So they're quite excited to be part of this presentation. So improved. I mean, it's justifiable. I mean, the objectives are improved quality of life, improved quality of care, freedom from abuse or neglect, but also you also have to preserve your personal privacy and preserve confidentiality as well too. For your professional staff, your nurses, your doctors, I mean, it's justifiable if you have reliable, valid data to guide assessment, improve treatment, protection from malpractice, or wrongful allegations. Yet you want to maintain confidentiality of medical records and personal privacy for residents, staff, and consultants. For your staff, I mean, clearly, they want protection from wrongful allegations. It's a tool for improved monitoring and residents for the safety. They do want proof of some provision of the quality of care, but also privacy as well too. They don't want to work under the gaze of a camera all the time. For your management, it's ethically justifiable if it's a means to maximize quality of life and quality of care of your residents. It is a fiscally responsible way of monitoring the facility, and especially on the entrances and exits. Some of our facilities are located in low-income neighborhoods where you can have some challenges, monitoring is necessary around the entrances and exits, and reduce legal risks for the care home. For families and friends, clearly, I mean, the families and residents, I mean, they want to maximize the quality of life and quality of care for their loved ones. But yet they still want to maintain privacy for residents, families, and friends. And for your visitors and volunteers, I mean, clearly, for those who are visiting, you want some improved security, you want protection from wrongful allegations, but yet you want to maintain privacy for the visitors and volunteers as well too. Now, collective agreements. You want improved workplace security for staff. I mean, if there's through surveillance, sometimes you can find out if there's any risk or any security risks that are taking place, or if there's any psychogeriatric residents who may be a risk to staff. But it also, you want to minimize risk of malpractice or wrongful accusation, but yet you also want privacy. I mean, they should be able to, provide care, and a lot of care is fairly intimate within a private setting. For your regulatory agencies, and there are a lot in BC. You have licensing, you have the Patient Quality Care Agency as well too, a board. If those are not satisfactory to a family or complainant, they can then of course go to the seniors advocate, they can go to the ombudsperson as well too, they can even go to the health authority itself as well too. So for them, what they want is reliable, valid quality of life and quality of care data to support your licensing and recertification contract renewals on an ongoing basis. It's a means quite often of quickly and accurately investigating complaints or allegations of wrongdoing, yet it maintains the privacy for residents and staff. So sometimes when an incident does occur and investigation happens, especially in a dementia care unit. It gets to be he said, she said, and sometimes your video surveillance film can provide more reliable data. And in terms of regulatory authorities, the six ladies, the six people you see over there are surveyors from Accreditation Canada. They are very senior nursing administrators from provinces Quebec, Ontario, Alberta, who in 2014 came and surveyed all Park Place long-term care, residential care facilities to ensure that we met standards. And the quality dimension standards that had to be met were 384 standards, everything regarding nursing charts, regarding your activity plans, your dietary menus, and what you're doing for staff as well too. For your funding authorities, what is ethically justifiable is that there's proof that care meets quality of life, quality of care standards, some information on the level of care, but yet, of course, privacy for residents and staff. Now, what is the legal regulatory sort of framework in BC that applies to surveillance in residential care facilities? And the province of BC has developed a substantial body of legislation to govern privacy in care homes. So you have the Community Care and Assisted Living Act of 2002, and Section 7 is the key operating provision of that legislation. And it says that a licensee must operate the facility in a manner that will promote health, safety, and dignity, and also the rights of those persons in care. The Act also provides that anyone licensed to operate a community care facility must display the rights of adult persons in care in a prominent place in the facility and in form and manner acceptable to the minister, and to make the rights of that person in care known orally and in writing to persons in care and their families and representatives. Now, BC a few years ago did pass a Residents' Bill of Rights, and under this Bill of Rights, which is under Schedule 7 of the Continuing Care and Assisted Living Act, an adult person has the right to the protection and safety and dignity as well too, including the right to all of the following: to have his or her personal privacy respected, including in relation to his or her records, bedroom, belongings, and storage spaces, and to receive visitors and to communicate with visitors in private. So, and your use of video surveillance cannot contravene this section of the BC Residents' Bill of Rights. There is also similar a patient Bill of Rights in the Hospital Act. And in BC you have two key governing legislation for residential care facilities. You have the Continuing Care and Assisted Living Act that governs most homes, but a third of the beds are governed under the Hospital Act Part 2, and most of them are usually extended care facilities that are attached to hospitals or older, more private hospitals as well too. And for under that legislation, what we have is the Patient Bill of Rights that applies. The BC residential care regulations is quite extensive, and the applicable section there is Section 53. The licensee must ensure respect for the personal privacy of each person in care, including the privacy of each person in care's bedroom, belongings, and storage area as well too. Now, there are also a whole host of other legislation as well too that applies in our sector as well too. So we have the Freedom of Information and Protection of Privacy Act, what is sort of abbreviated and known as FOIPA in our sector, and that relates to the records, charts primarily, of all residents who are in government-funded residential care beds. And then you also have the Personal Information and Protection Act, and that relates to all nursing charts and personal information of residents in private pay residential care facilities. And then we have the Ombudsperson Act, the Patient Care Quality Review Board Act, as well as Seniors Advocate Act, and all of these have powers of investigation, to follow up on any complaints that are launched, and the powers are quite wide as well too. The Ombudsperson Act, as many of you are familiar, did carry out a very wide-ranging review of seniors care in BC, a few years ago, and issued a 3-volume report that's quite extensive, with I think over 200 recommendations in that report as well too. The Seniors Advocate Act is fairly new. It was just passed in 2013. We are still waiting for the regulations to be enacted under this legislation. But the Seniors Advocate is mostly looking at systemic issues, large issues that affect our sector. And surveillance, one can say systemic. So it's a new and emerging area that affects many, and that is one that the Seniors Advocate may take a look at if she thinks it warrants her attention. Okay. Under federal law, Criminal Code of Canada, there's legislation that governs voyeurism. There is a defense. As long as you're serving the public good, then that section does not apply. And also, you cannot intercept private communication over the phone. And again, there's a defense as well too. As long as it's consent by one of the parties, then that is fine as well too. So to go over and pass the Criminal Code of Canada, usually most people acknowledge as video surveillance at the site so that it removes the expectation of privacy to occur. So, and that is one thing that facilities do. In 2011, there was a very well-publicized coroner's investigation which used video footage from a North Vancouver care home. It was fortunately not a Park Place home, and a resident had died. The care home had reported that the resident had not shown signs of distress and had died after breakfast while alone in his room. A family member contacted the BC Coroner Service with a conflicting report that the resident had died after choking on food while being fed breakfast by a staff member. The family had surreptitiously set up a nanny cam in the room and had a video of the incident, which was then sort of turned over to the coroner. The coroner's report was quite extensive and concluded that the resident was a challenging patient to care for, staff was ill-prepared and incapable of dealing with his issues known to exist in the elderly and vulnerable population in such facilities. If not for the video brought forward by the family, the resident's accidental death would not have surfaced. The coroner's report does not really look at the ethics of the video placement in the room, but that's a key report in BC. Who's watching? I mean, there's spyware everywhere, and in the United States, some states have passed legislation to allow video surveillance in nursing homes. Texas was the first state to pass such legislation. They expressly permitted installation of surveillance camera, but prior to the installation of cameras, express written consent is required from the resident or the resident's guardian. The notice of surveillance must be posted both at the entrance to the care home as well as at the entrance to the resident's room. And since Texas passed that legislation, there have now been at least several other states who have passed legislation, similar legislation. So Maryland, New Mexico, Washington, and Oklahoma as well too. But some states have rejected passing such legislation as well. So it's a hot debate. So surveillance, pro and against in residential care homes. If you have the reasons for surveillance, if the suspicion, families are concerned that they're not receiving updates about their loved ones, concerns about understaffing, there's a history of violations, there's a belief that surveillance will result in more attentive care. On the other hand, you do have to have privacy issues and respect and dignity issues as well too. You're filming the most intimate moments, bathing, toileting, clothing, transferring, feeding, etc. And when I talk to our directors of care, what do you think? I mean, today, on a practical basis, at Park Place facilities, most of our staff, we carry on our duties knowing that we may be filmed at any time. They always expect that they may be on camera. But of course, the reality is that if you talk to an experienced director of care, they will say that it's fairly creepy to have somebody watch mom receive peri-care. That's their sense of it. And sometimes it's all a negative reaction by caregivers as well too. There are alternatives to surveillance. Build trust, improve engagement with residents, families, friends from the outset. Will establish strong partnership. Have an open door with visits. You have your best practices, resident-centered care, and Accreditation Canada. You have your teams, include your families in your teams as well too when you are reviewing. Meeting all the quality standards, and that is key as well too. As part of Accreditation Canada, for example, Park Place, we had a survey of 900 of our staff filled out employee surveys about how they feel about working at our facilities. Okay. Again, the video chats are very helpful, utilizing software and private password-protected online logs to share daily reports are also very helpful as well, especially around events like pub nights and bowling, etc. Care homes, may be tempted to install surveillance, but there's also, privacy also has to be strongly regarded as well too in this decision as well too. Looking at upgrading your homes, improving sight lines, looking at schedules, really helps as well too, and planning with your care teams on what it is. One of the items about care surveillance and monitoring that I do want to discuss is bed alarms, bed and chair alarms. They have become quite you see them quite often now in residential care facilities when they are sensor pads, and when a resident gets out of bed or gets off a chair, the alarm goes off, right? And the alarms, some of the portable alarms are very loud and very disturbing for residents. So if an alarm is used, we need to sort of switch to a system that sends an alert directly to a care aide's pager, as opposed to setting the alarm off in the room. It's very loud, and it's actually quite it's quite constraining to a resident as well too. We had a discussion yesterday about hip protectors, floor mats to minimize injury as well too would be helpful. At two of our sites, Spring Valley in Kelowna, we were able to reduce bed alarms to 10% of residents. At our facility in Calgary, the administrator there took a lead and was very opposed to bed alarms, and it was getting to be a real nuisance, and has taken a lead, and has we've been able to manage reducing the use of bed alarms by looking at our restructuring our staffing in our care neighborhoods as well too. The other thing that is used for monitoring is your wrist and ankle bracelets. They sound alarm if the resident tries to leave the unit. Park Place does not use them, and we have not used them for over 20 years. We just feel that it is very undignified. There are better ways of monitoring your residents. The residents hate them. They will take scissors and cut them off the wrist, or they'll try and yank them and just injure themselves. And the ankle bracelets as well, to lugging that around, is they just hate it. So we have done away with it altogether. GPS locators we've sort of had some experimentation, but it's not popular in residential care at all. It's not used at all as well too. So Park Place, we operate in BC and Alberta as well too, and we have spoken to this.
What do you use if you don't use the ankle or wrist one? What do you replace that with?
What we do is, if you have a neighborhood, we will have keypads on the door. The neighborhood is their safe space. They can walk around and wander around that neighborhood as they wish. In a dementia unit, when families come in, we will tell them ahead of time that, mom and dad, this is a dementia unit. Residents will wander into your loved one's room, and they will be walking, and they will check the closets out or the drawers out. They are, and similarly, your mom may walk into other residents' rooms as well. So you have to be respectful of that. Don't get upset if you see another resident in your mom's room fishing through the closets or the laundry. You educate around that. You do leave handbags with scarves, around, and they love fishing through that. So these are some of the tools that we do use. Thank you.
Still morning, right? Is that right? It seems like it's been an early morning. Thank you. Welcome. It's a pleasure to be here. It's been a while since I've attended a Friesen conference. I was in that second cohort of doing my master's degree in gerontology, and that seems like a long time ago. So I'm a gerontologist by trade, and I'm currently providing some consulting services to the family caregivers of British Columbia. That's their soft launch. You'll see that it says Family Caregivers Network Society. They've now changed their name as of, I think, yesterday, so there wasn't quite enough time to change the logo. My other hat that I wear is I actually do a lot of work with families and seniors on Vancouver Island, and I do a lot of work around providing advice and referrals, private geriatric case management to help people understand their options as they age, to support family caregivers in supporting the individuals that they're caring for, to look at how the private and public sectors meet, and how to make informed choices about remaining independent for as long as possible. And I have to admit, I didn't have a lot of knowledge around technology and aging, and so this conference has been amazing to attend. So before I begin, I just want to share a story around surveillance and monitoring. It actually involves myself. So about 4 months ago, I ruptured my Achilles. I don't recommend that. And I had surgical repair. I was in a cast, and at the time I was of the surgery, I was living alone in my home. And when I came out of the surgery, it's a very quick surgery. The nurse was very adamant, about me following protocol and taking my medications properly. And when you get home, make sure you take 2 of these morphines. And as an obedient patient, I did. And I got home. It was probably around 3 o'clock in the afternoon. I took my morphine. I've never taken morphine before. So you can only imagine what happened. So about midnight, I wake up. I'm disorientated. I'm clearly cognitively impaired from the morphine, and I had forgotten about my Achilles. And so I attempt to walk to the bathroom. So we know that I fall, and there's nobody living with me. And the first thing I think is, where is my PERS? Where's my personal emergency response system? And I click a button. Of course I couldn't. I had to drag myself across the floor to reach my cell phone, to call my trusty neighbor to come over and help me locate my crutches, because I couldn't go back and find those, and just to make sure that I was fine. So I was thinking to myself, here I am at 42, I could have used some surveillance and monitoring post-injury, but a little insight into perhaps some of my own challenges 40 years down the road, and how far ahead we're going to be. So what I'm going to talk about today, it's just important to know that I'm not a lawyer. I have no legal background whatsoever, but I do a lot of work with family caregivers and seniors, and so my perspective is going to be more from a consumer perspective, taking a look at some of the current technology and who might benefit from that. What are some of the pros? What are some of the cons? To look at a case scenario, and then I had a chance to call a couple of companies that offered this, various levels of surveillance and monitoring, and got some ideas about what that entailed, and asked them some questions about how they deal with individuals who are a bit resistant, or what type of information do they collect from individuals, how it's stored. So I'll share some of that with you. There we go. So this is Mr. Roland. He's an actual client, or he was a few years ago. He's moved into complex care now. So I live in the Comox Valley. It's fairly rural in Comox itself. Its population about 12,000. And Mr. Roland was a widower. He was 86 years old at the time that we were providing support to him. And he had a daughter in the back who had a very young child, as you can tell. And she had a husband who worked regularly. She had another older child as well. And Mr. Rowland was living slightly rural, could still access bus routes, but it was a little bit far removed from the actual town of Comox. And he had had a stroke. Was very mobile, still very functional. Required home support, so was receiving 3 visits a day. You had your basic assistance with housekeeping, meals, medication reminders. But one of the areas where was big concern was he was at risk of falls, and he was a logger in his previous days, and he loved to go out into the trails, and had shown some poor judgment with regards to his ability to dress properly, the appropriate timing to get out into those trails. And so one of the particular situations that happened was Mr. Rowland got up one early spring morning. It was about 5 o'clock in the morning, and he thought it would be a fantastic day to go out for a hike, which he was right, it was a fantastic day. He was dressed in only a pair of shorts and T-shirt. It was about 3 degrees outside. He went out to seek the trails. Thankfully, a neighbor who happened to be up walking their dog noted that Mr. Rowland likely shouldn't have been outside walking towards the trails and was able to alert the family. And so I was thinking to myself, well, Mr. Rowland would have been likely a really good candidate for some of these surveillance and monitoring in the home. He likely could have benefited from it. His daughter, lived about 10 miles away, but was really busy with her own family. She still came in every day, but there was still probably about 18 hours of the day that Mr. Rowland was on his own. He was receiving about maybe 6 hours of actual support during the day. So in terms of who can benefit, I had an interesting conversation. I called a couple of my clients because I was curious about their take on things, and I called a couple of family caregivers. And one of my family caregivers said, well, it shouldn't be called surveillance and monitoring, it should just be called peace of mind from a family caregiver's perspective. And I thought, you're absolutely right. And then I talked to one of my 95-year-old clients who lives independently in her own home, and she receives about 2 hours of private care per day. And she said, well, surveillance and monitor, that to me would equate loss of independence and loss of control. And I thought, you're right too. So you can see how there's sort of these meetings somewhere. How do we meet in the middle here? But so who can benefit? Well, clearly family caregivers can benefit. If you live afar, or if you're working full-time and you have young children, or you just lead a really busy life, it can provide some peace of mind. If you're providing heavy care and you require respite, I think about, you look at the statistics around who's providing care, and we know that spousal caregiving is huge. And so we often have 94-year-olds, 95-year-olds living in their own home. And if it were not for that spousal caregiving, they would be hooped. We know that. But those aging caregivers have their own health concerns. And so if they're providing heavy care, whether it's grooming, personal care, but even ongoing cueing, it's a very physically and emotionally tiring position for that individual. So you could see how some of these particular surveillance and monitoring could actually assist and provide some respite for those spousal caregivers who are really close to being burnt out. And then, of course, the sandwich generationers who have their own families to care for, who are often working full-time, and geographically we do see there's a lot more long-distance caregivers. So in terms of the actual individuals who would have the devices or the sensories inside their home, yesterday we talked about how do you package it so that the individuals agreeing to it understand the benefits. And so it's, looking at the risk of falls, the risk of, wandering, you likely wouldn't, that's a benefit again to the family caregivers, but trying to find that benefit for the actual client itself. The confusion or forgetfulness, that was a mouthful, with activities of daily living and those individuals with complex healthcare needs. From a family caregiving perspective, I would say that it has the most benefit. And one of the questions I asked some of the companies was, well, who do you deal with directly? Who pays for your services? And what are some of the challenges when you go into someone's home to set it up and they don't want the service or they don't want the surveillance? How do you end up dealing with that piece? And I think that's a really important question for us to explore further. So just quickly, we'll talk a bit about the pros and cons. So one of the interesting things is really how affordable some of these surveillance and monitoring techniques are compared to, say, private home care. You looked at the range of pricing, and you're looking at anywhere sort of between $100 to $250 per month. I mean, that's the equivalent to less than 10 hours of private home care. So in terms of affordability for some individuals where those needs are really, really high, you could certainly see how that would be, could certainly be a benefit. They're typically very easy to install and use. When I spoke to the individuals, they're typically they can be very passive, and so the individuals where it's inside their home, they're not required to do anything to prompt it or to interact with it. Although in yesterday's presentation with Clarice, I was intrigued by that the interface piece and the interaction piece, and really it provides peace of mind for family caregivers and for those seniors who understand the technology and how it's going to assist them. It also provides them with peace of mind knowing that their caregivers, their family, their adult children and spousal caregivers feel a reduced sense of anxiety and burden. So some of the cons, in most cases, they still actually rely on a caregiver or a health professional to react to the alerts. So there still needs to be that secondary piece where the caregiver might get the alert by text and they still need to respond. There's typically no direct human contact. And typically we're looking at these physical responses rather than emotional. Although last night with Ed, the robot, he was pretty darn close to direct human contact. I marveled at some of the individuals that actually were interacting with Ed. I could have a lot of use for Ed in my own home sometimes. When I go to that 8 p.m. Cupboard with the chips, right? I could have Ed tell me, "Do not open that cupboard, Wendy." And typically, the seniors that I spoke to, I spoke to about 5 clients. Any devices they typically have in their home right now, they find them very complicated to use, and also they feel as though it's a real intrusion in their own privacy and this sort of fear of Big Brother. I was pleasantly surprised with some of the technology, the music box, and some of the more simpler interfaces. I thought we're certainly moving forward to making it a lot easier to use. So what I just wanted to touch on is that there's different levels of monitoring. Obviously, there's the no tech. So I don't know many of you that have neighbors or elderly residents, but the no tech is the opening and closing of the curtains. So in the morning, your neighbor across the road, they open their curtains to let you know they're okay, and they close them at night to let you know they're okay. That in itself is a very no tech monitoring, check-ins from friendly neighbors. And then our low tech typically might be a bit more of a personal emergency response system, medication dispensing, and then the high tech is looking at those video cameras, the sensory detectors, and the interface with the users. So I think there's a real scope that people can tap into. So finally, I just did a very quick cursory search and what's on the market. These were some of the companies that I found. I did have a chance to actually call and to speak with individuals about their product and how they work and the price range. It sounds like I have a minute left, so I don't have a lot of time to divulge into that. But I think what I wanted to finish up with is that I think from a consumer perspective, it's really, really important that whether you're a family caregiver or an aging individual yourself, that knowing the right questions to ask about a product, knowing what your needs are, so understanding where you might benefit from these particular technologies is really, really helpful. Asking about how the information is being stored, how it's being used, who can access it. With the CareLink Advantage, for example, they have an interface that all the caregivers can access. and it shows you, if you've opened the door at what time. Alerts might go by if it doesn't fit the pattern. But the question is, well, taking a look at, well, who's going to use that information? What's it being used for? Can anyone access it besides the users themselves? What's the safety around that? How comfortable are care staff knowing that they're on, a video camera, even though it's not directly related to their position, especially if you're using, say, the public healthcare system? How does that interface with those two? Those were some of the questions that I had as I was calling those individuals. So as consumers or individuals going forth, I think it's really important to consider that piece. And I'm hoping that we might be able to explore that a little bit further. So thank you very much for your time.
Okay, I'm going to try to do two mini topics here. One is about the law, going into a little more detail, or just pulling apart so we can feel a little comfortable with two of the most critical pieces of legislation that were referenced. The laws governing collection, use, and disclosure of personal information. And the second thing I'd like to do is talk a little bit about how little is known about the effects and efficacy of surveillance technologies in this context. So first I'm going to do a little bit of a legal waiver. I tell this joke about myself when I talk to patients' rights audiences, because I come from patients' rights. That's what I used to do before I was in law school. And when I was a patients' rights advocate, I tell you, I knew the law. I would always say, you can't do that, it's against the law. That's discrimination. I knew everything about the law. And then I went to law school, and now all I can say in answer to any question is, it depends. Right? It's kind of a drag this way, but I want to explain a little bit about why, particularly in this context, it depends. So I want to unpack a little bit about how they go about developing what are essentially the legal test. It's not a hard line that says over here and over here, go in this direction. It's a test, and so you have to apply the facts and the context to the legal principles, and then you come out with the answer. That's why so often it depends. So firstly, just about any surveillance of people that you can think of, whether you're monitoring their location, whether you're monitoring blood pressure, whether you're capturing visual images through a camera, that is data about an identifiable individual, and it is personal information for the purposes of statutory privacy law. So just about anything you can think of relating to an identifiable individual. And so for the purposes of this discussion, we're going to say that there's three classes that are relevant. One is private citizens. Then there are service providers in the public sector, service providers in the private sector. Now, service providers in the private sector, so that's not government facilities, private sector, are governed by, I'm going to say PIPA. We've already heard this before. It's the Personal Information Protection Act. Now, here's a thumbnail sketch of what the private sector's privacy obligations are under this act. The private sector can collect, use, and disclose personal information for purposes that a reasonable person would consider appropriate in the circumstances. Okay, you can see why it depends, right? Okay, the reasonableness standard maps all over privacy law. Now, with few exceptions, the key concepts in the private sector are consent. The Act requires consent for the collection of personal information, although the consent can be implied, where it would be obvious to a reasonable person what the information is for, and the individual is voluntarily providing the information for that purpose. So whether the consent is express or implied in the private sector, the ability to collect personal information is limited to those purposes, again, which a reasonable person would consider appropriate in the circumstances, and that fulfill the purposes that the organization says it needs it for, or that are otherwise authorized in the Act. So what that protection essentially includes is the idea of, if I just on a sideline want to ask you what your IQ is because I'm interested, even if you consent, it has no relevance to what it is that I'm providing a service for. I'm not supposed to be asking that question, right? So it's got to be reasonable. Consent, express or implied, that's kind of the private sector kind of go-to. Now, undoubtedly, there are some entirely uncontentious usages of surveillance technologies in this discussion, especially if a solid safety and security case is made. But it likely, in the private sector, still requires consent. But in the more privacy invasive technologies, the more speculative the safety and security case, the more likely you are to run afoul of the reasonableness standard. So further, it's not only, as we've been discussing in scenarios and how complex this is, residents' personal information that's going to be collected with some surveillance technologies. Cameras in particular are going to collect personal information of staff. What PIPA says about the collection of personal information of employees is that you can collect that personal information if it is, maybe we could get a chorus going here, reasonable for the purposes of establishing and managing or terminating an employment relationship with them, and you give them notice. So, the only time under this Act that you are allowed to collect employee information covertly, secretly filming them, for example, without notice, is if it is reasonable to expect that providing notice would compromise the ability or accuracy of the personal information, and that particular collection is in relation to a reasonable investigation or proceeding. Has to be a specific investigation or proceeding. So not simply covert monitoring of staff being allowable because, oh, maybe something bad is going to happen here. Not under PIPA. Okay? Meaning the private sector. So,
but if the staff know ahead of time,
then you require notice. You require notice. Okay? And again, even then, it has to be reasonable. So blanket surveillance may simply not be unreasonable. So let me give you an example. There were two cases that the Privacy Commissioner just ruled on about GPS monitoring, right? GPS monitoring essentially of two banks of employees, one in a elevator operator repair company. And part of the argument was, look, it is absolutely reasonable to say we need GPS monitoring because if you're stuck in that elevator shaft, we need to know. That's a good argument. But if you ask to hang on to this sensor 24/7, right? Not reasonable, right? So during your work hours, not your lunch, et cetera, et cetera, et cetera. So it's that finely gradated in terms of what constitutes reasonable employee surveillance-wise. Okay? So over into the public sector, in the main, the privacy protections are not as good in the public sector as in the private sector. Consent is less central in the public sector. The public sector does not need consent if the personal information it is collecting relates directly to and is necessary for the program or activity of the public body in question. That's correct. So the public sector also doesn't need consent if the collection of personal information is authorized under an act. So a specific act says you need this information. So that's, again, another subsection. And if the information that is sought is not directly related to a program and isn't in a statute, the public body still has an opportunity to collect the information if, in this case, it gets consent. So there's three opportunities. Relates directly and is necessary, authorized under an act, or you get specific consent. Right? So even though the public body doesn't have the same requirements for consent as the private sector, it nevertheless also must provide notice. That is, it must ensure that individuals who it is collecting personal information from are told the purpose for its collection, if that's not obvious, the legal authority for collecting it, and who to contact if they have any questions. So the public sector, similarly to the private sector, has to give notice to its employees of collection of personal information and can only forego notice in pretty much exactly the same scenario as the private sector. Specific investigation, and the notice would undermine the ability to investigate that specific inquiry. The public sector, unlike the private sector, has enhanced security, information security requirements. Personal information must be stored in Canada. That means if you're using a cloud server, the cloud must be in Canada in the public sector. Not dissimilarly to the private sector, a case can be made for the use of surveillance technologies, but again, it requires a case. So in the public sector, if the facility is planning to proceed without consent, then it will have to argue that the collection of the information relates directly to and is necessary for the program. And the greater the vulnerability of the population of people that they are serving, the higher the safety needs of those service users, the greater the case for necessity. But again, the lower needs of the demographic in combination with a highly invasive technology, much less likely to meet the test of necessity. So finally, private citizens' homes. In the main, there are no laws relating to the collection of personal information in private residence. There are still some legal matters that could arise. For example, civil law, criminal law, we discussed that, voyeurism, criminal voyeurism, et cetera, et cetera. But in the main, if you're monitoring your own home, you are free to do so. If you are receiving care in your home and you have a camera in your home that captures the personal information of a service provider who is attending you in your home, essentially nothing stops you from doing that except possibly a clause in your contract with the service provider. There's no statutory prohibition on that. And on the other hand, while you have a right to monitor yourself in your own private residence, you probably have no right to monitor your family member or yourself in a facility residence. So now I can't think of a legal reason why you couldn't have that surveillance technology in your family member's room or your own room in the facility if the facility and staff agreed to that. Right? But unlike some U.S. jurisdictions that we were hearing about, you have no legal right to place a camera in a family member's care facility. So essentially, the facility could remove the camera if they knew it was there. Although sometimes they don't, if you bury it in a teddy bear. That's the lesson from that. So the easiest way to look up the privacy legislation that I've been referring to, PIPA and FOIPA, the way that I suggest is to go to the website of the BC Information and Privacy Commissioner. The button that says About the OIPC has a drop-down that will give you the legislation. They also have go-to guides for things like video surveillance, et cetera, et cetera. So that's www.oipc.bc.ca. Or you can just plug into your search engine, BC Privacy Commissioner. Their website has got information on that. So 5 minutes, that's perfect. I want to say a quick word about the potential for the unintended consequences of surveillance. Whenever somebody wants to use surveillance or monitoring technology, they're trying to achieve a benefit. In this case, most usually safety and security. But the lived reality is that introducing new tools often has unintended consequences. So these are often not simple policy equations. Monitoring is often seen as viable and a much needed alternative to a series of issues and concerns, including the chemical and physical restraints of residents in high-level care with lots of dementia and Alzheimer's patients. And this, of course, is massively important and needs to be encouraged. We need alternatives for these. On the other hand, we also cannot ignore that many surveillance technologies in this sphere are sold to providers as cost savers and are in fact meant to displace as opposed to optimize needed personal care. No one has an unlimited budget. So if facility X has a certain amount of money to spend on enhancing patient care, resident safety, should they spend that money on technology for monitoring or another staff member for that analog monitoring? Should they? Now, wouldn't this be a great thing to know? I want to know. So last year I tried to see what kind of research had been done into the efficacy of the new surveillance technologies in seniors' care. So we had some means of comparator. What should we do? And I found that hardly any exists. So in answer to the question of what would best promote the ends of safety and security, the answer is at this juncture, we just don't know. What we can say is that alongside much of the hope for the new technologies, there is an increasing concern that new models are inadvertently selling abandonment as autonomy, and that some of the technological imperative is intending to displace, as I said, personal care. And so what I'm urging is not only a research agenda here, but that we analyze this in the broader ecosystem of care. It is possible that changes in the overall ecosystem of care can and will make residents less safe than homey, old-fashioned personal care. And we need to remember that tools shape practice As Ursula Franklin so critically reminds us, we love to believe that practice shapes tools, but the science doesn't support that. Tools shape practice. So what I want to urge against, and the cautionary tale that I'm going to commend to you, is one that you would find, again, if you want to plug into your search engine, a report called Fortress Britain. And Fortress Britain is about securitization of space. And the notion here about what has inadvertently happened when embedded in best practice and, importantly, insurance guidelines are a series of technological solutions that actually undermined people's sense of personal safety and security. So I'm not suggesting that there is an agenda here to do such a thing, but that these policy considerations are vexed. We don't have the needed research in order to make truly informed decisions, and that we need to move cautiously, especially before, as we go on necessary experimentations, we don't in-build standards that turned out to be quite perverse in terms of the outcomes we had intended. Thank you very much.
Question, yes?
Thank you very much. Les Rowe, I'm a retired teacher. There are several things that were spoken about this morning that speak to the need and the requirement for balance. Balance between dignity and the respect for all concerned, both the client and the provider of service, and some kind of ombudsperson or group, and the whole question of whistleblower protection when things turn out not to be quite what they should be, very much like the last thing that was mentioned regarding Fortress Britain, for example. Thank you.
Hi, I feel like I've been up here a couple of times. This is a very passionate topic of technology and aging in place. My name is David Rittenhouse. I'm president of Integrated Tracking Technologies, and I'm also a volunteer co-founder of a public safety program in Victoria called Project Lifesaver of Greater Victoria. And I feel like I'm looking at things from the private sector as we design and manufacture wireless tracking technology, wearable tracking technology for people with cognitive impairments. So I feel like I'm amongst my tribe here. I'm interested in the topic, many topics, both from healthcare delivery for, to help family caregivers caring for someone at home, and as well for professional caregivers who are caring for people throughout the continuum of care and the issue of elopement. I'm interested, actually, a question regarding the study of GPS trackers, and there was mention about how trackers have been used. Are there any more examples of how effective the GPS trackers were in helping in the care facility environment?
There's some sort of positive results from using GPS trackers, especially in the event of elopement. The key thing is that from a very practical perspective, when you have the trackers and placing the trackers with the residents, either when you keep it in the pocket or on their person, when it comes back, the staff will throw that in the laundry. It gets washed and gets damaged and destroyed, and it's very hard to replace. Alternatively, the resident may find it or whatever, or you can't quite wear it on the wrist. Forget the ankle. They'll cut it off. It's very irritating. You sort of try to hide in the shoes, or you sort of pin it to them. But it's just that's the primary sort of issue around GPS trackers. Now, if you are able to secure your facility, and you do have, it's keep at it. The neighborhood is safe space. for the residents. They can wander as they wish, and it reduces agitation. It reduces their irritation. They have access to wandering loops in the courtyard, and is designed in a manner that is accessible to them. Then that is the alternative that most residential care facilities have gone after. We're sort of in a position where we do have that alternative. Now, for elderly residents at home, living at home, GPS trackers may be a more viable alternative, and that's yours. If you have any comments on that.
Just a question about for the Residential Care Act, and it talks about privacy and the rights of a resident for within the facility. Is there the issue, and many people touched on this, it's a balancing act between the resident's or a client's right to freedom and liberty, but then as well there's the caregiver responsibilities balance to keep them safe, especially with someone with a cognitive impairment, someone who has diminished mental reasoning, who might walk out into traffic, walk into the ocean, if they do elope. One of the things we've seen with Project Lifesaver is that many care facility operators in Greater Victoria view Project Lifesaver that uses radio tracking technology as their second line of defense to elopement. So you're right, facilities do need to have the elopement prevention strategies in place and the security systems, but with the new emerging technologies, and Project Lifesaver has been around for 15 years in North America, and with the emerging tracking, wearable tracking technologies, I think there's an opportunity to look beyond the front door in terms of offering residents a safe way for them to be located by caregivers, both professional caregivers and family caregivers, and how these technologies can quickly locate people and bring them back to safety. And then as well also giving family caregivers, like you said, the sandwich generation, the ones who are using their smartphone for everything, they want to be empowered to have peace of mind to quickly and effectively locate their family member if they wander away.
Thank you.
We've gone over time here a bit, so I don't know if people will let us have one more question, or do you want to go have a break, or one more? Okay. I get the last word. Yes. I'm Lily Liu. I'm from the University of Alberta, and in fact, David and I are going to have lunch soon to talk about potential collaboration. At the University of Alberta, we are just completing, and by the way, I'm a member of the Age Well Network as well. So we are just completing a study that has been completed in collaboration with our Alberta Health Services, Health Authority. So it's a provincial-wide study, and also in collaboration with industry. In this particular case, it's with Safe Tracks. In fact, the vendor is just about to show up, and we'll be having lunch as well and discussing going forward what we're going to do. So the study is funded by AHS, so which is interesting because it's a consumer product. We have 3 products that we are testing, that we have tested with 47 dyads of caregiver, so care partner with individuals with dementia. This is through home care. The 3 devices are a small device that's like a cell phone that's worn around the neck on a lanyard, or they can clip to a belt. The other is a wrist watch type device that is lockable. And then the final, which has become quite interesting, is GPS-enabled insole that is worn in the right insole of the shoe, and it's become quite popular. So we actually have data, and I really enjoyed your panel because what it's I think reassured me is that we've been addressing the right questions, looking at the ecological issues surrounding the use. Our whole intention at the beginning is to use GPS in the community to try and help the caregivers or the care partners. And what's interesting is over the course of, so on average they've used it for about 5 months in this one-year study. And what's interesting is that some of them have had to go into facility care or were on a wait list and of course want to take advantage of this. the families wanted to keep the GPS devices, and we found that they were actually useful in the facility as well. It allowed them to start to participate in activities outside of a locked unit. And the facilities, some of them even wanted to get involved in the monitoring as well. So the data is coming out. We have objective quantitative data as well as focus group type data that is, I think, going to be very interesting. And then my last point to make, which I think will be of interest to this audience, is that Alberta Health Services actually has a branch now that is seriously contemplating funding these consumer products, although it was designed to be used with caregivers in the community. So that's really exciting.
I know the focus of our panel was widespread, but I'm sorry, I forgot your name, but Dave, thanks. It brought up a really good point about with regards to the family caregiving piece, and although it's really important from the individuals who's actually using the product, the senior themselves, and understanding that risk and the ethical piece, from a family caregiving piece, when you look at the fact that 80% of all care is done by informal caregiving, I think that how products are designed to support that piece is really important, but it shouldn't replace. It should be a complementary, and I think that's one of the important messages too, is that it's a real spectrum, isn't it, of products, both no tech, that's that nice personal hands-on, you don't want to lose that, but then there are some really important components where having that high tech would be really, really helpful with regards to collecting that information and using it in the right way. So thank you.